Hi, Dr. Jen Andrade, the Active Persons Chiropractor, and today I wanted to talk about a common condition that I see in my practice, and that is runner's knee. It is also known as patellofemoral syndrome, and I will define what that is in a minute, but I want to talk a little bit about some of the common causes of runner's knee first, and then we'll talk about what's involved. And then I will make another video about things that we can do to prevent it. Runner's knee is actually not a great way to name it because it's not only in runners, it's common in them, but other people can get it as well. But the general idea of what happens is when we have a lot of repetitive movement of the knee, so the knee's main movement is to flex and extend, that can cause irritation to the structures around that and pain, which they have called runner's knee. It's common because when you're running, you do that movement a lot. So let's talk about defining some of the terms. We talked about there being an alternate name, patellofemoral syndrome. It just is named that way because it talks about the two structures that are involved. And the two structures that are involved are the patella or the kneecap here. And then we have femoral, which stands for the femur. The femur is the thigh bone or the upper leg bone. It is the interaction between the kneecap and the thigh bone that causes runner's knee. So there's a couple of causes runner's knee that I want to talk about. First of all, we talked about overuse. So doing that same movement over and over and over again. When you go above and beyond what your body is able to adapt to, that is when we get injuries. Lots of different factors can go into where that adaptation level is for you. I'm not going to get into that right now. That's another video. But let's talk about some of the common causes. We can have malalignment. That's what medical terms will call it. I'll call that a subluxation or misalignment. Basically, what that means is some of the joints, the bones, are not in the correct position. In this condition specifically, we can often see that kneecap is not staying here in the middle, in the groove on that femur. So that can cause problems. We can see that the lower leg bone is twisted. We can also see that the ankle or foot is not working properly or misaligned, or we can even have problems in the hip or the pelvis that can all be affecting the knee. We can see imbalance in the muscles in the thigh around the knee. They help to keep that kneecap in alignment. And if either one muscle is working too hard or it's not working hard enough, that can cause problems for us. And another reason that we can see this happening is when we have another condition called chondromalacia patella. So I'm going to define what that is. Chondro means cartilage. Patella, we already talked about, is the kneecap. And then malacia means softening. What that literally means is that there is softening of the cartilage underneath the patella. If we have softening of that cartilage, it can get irritated and it can get kind of torn up, and it can cause a lot of irritation and pain in the knee, specifically when that patella or kneecap is moving over that femur during running. Other things that might key you off that you might have runner's knee, I think it's important for you to kind of have an idea of maybe this might be runner's knee, maybe I need to get help with this, is pain with running or repetitive flexing or extending of the knee, or pain when we are going up and down stairs because we actually do a lot of flexion of the knee in that instance, or when we're squatting down because we are really stressing that knee and putting it into that flexed position. Those are all indications that you might have runner's knee. If that's something that you're struggling with, I would definitely recommend consulting a professional, a chiropractor, a physical therapist, a sports medicine practitioner to help you with that issue. Hopefully you found this helpful. Thanks for listening. Dr. Jen Andrade, the Active Persons Chiropractor.